Good evening, and welcome to COVID-19 Vaccination Saving Lives. We're very pleased that you are joining us either on Rogers TV, which is now airing throughout Simcoe County, or accessing us on your electronic device by streaming from either the Rogers website or from Facebook Live. My name is Keith Rose, and I'm your moderator for this evening. It's my pleasure to introduce our two speakers sitting beside me. They're going to put their hand up so you'll at least know who the first one is and you can figure out who the second one is. So Dr. COLIN Lee. COLIN is the Associate Medical Officer of Health for Simcoe-Muskoka District Health Unit. He specializes in communicable disease control and vaccine preventable diseases. He's been on the front line for COVID-19 decision-making for over a year now. Dr. Kevin Young holds several leadership positions at Waypoint Centre for Mental Health Care and in the Provincial Geriatric programs. He provided frontline medical care and education in the management of the outbreak at Waypoint, which involved both staff and patients. He also helped and coordinate Waypoint's vaccination program for those staff and patients. Well familiar with both of them, are very familiar with the things that we're going to talk about tonight. We're lucky that both of our speakers are well known to the Our Health program. Kevin participated in Matters of Memory and Hearing Loss, Sounds of Silence a couple of years ago, and COLIN about three or 4 years ago at Going Viral, Preventing Infections in Our Community. I bet you didn't know you'd be back, COLIN?
Good to be back.
Okay. More detailed biographies are available in the electronic brochure that came to all of you. It looks something like that. And so we've written a bunch out. You can happily to refer to that when you have time. I have some collective thank yous before we want to start. The first is the Our Health Advisory Committee, who help with everything that we do for our programs, but specifically thanks to Kathy Wolfer and to Ted Shivers, who did a lot of the detail and hard work for this particular program. To our 7 local sponsors, who I'll thank more formally a little later on in the program. And to the extraordinary staff at the MCC and Rogers TV, who make us look good, sound good, and give us all the advice to make this program successful. I'd also be remiss if I didn't thank the Simcoe-Muskoka District Public Health Unit for their work on this program, their media people, and specifically to COLIN, who works there, but also to their fearless leader, Charles Gardner. I don't know how he stays happy and calm in all of the challenges he's had over the last year, but we have good leadership at the health department. So tonight we have an opportunity to talk about COVID-19 vaccinations from the time that they were identified in the laboratory right up until the time we received the shot in our arms. Currently, a little over 1% of all people in Ontario, and that includes Simcoe County, have contracted COVID-19. Several have died, many have been hospitalized, and so many continue to suffer the long-term effects of this disease. But there is some good news on the horizon. To date, over 10 times the number of patients who had COVID, 10% of patients in Ontario have received at least 1 dose of COVID-19 vaccination, and that number is rising quickly. Our goals tonight are simple. We will tell you the facts, and we're going to debunk the myths. During the first part of the program, Kevin is going to tell us about the vaccine, how it was developed, what it's like, and COLIN is going to tell us about the logistics of the rollout plan. During these discussions, we'll also be addressing safety and hesitancy issues. So we're going to do some back and forth throughout the program, as we usually do. I also have received several questions from the audience in advance of tonight's program, and I'm going to incorporate some of the themes from those questions within our discussions during the first hour of the program. There'll be an opportunity in the second part, the last half hour, to take your specific questions. And to do that, all you need to do is send them to that email address, which is in the bottom of your screen, mcc_ourhealth@outlook.com, or you can add them to the chat line on Facebook Live, and I'll see them here. Kevin, over to you.
All right. Well, thanks for that introduction, Keith. And it's really a pleasure to be here tonight. And I'm very excited to be talking about vaccines and, sort of thinking about what it is that we can do to bring an end to, this era of the pandemic and how much it's changed our lives. I'll be very open to say that I've been vaccinated myself. I feel that it's quite safe. I felt that it was the right choice for me. But, even more than that, I really saw how vaccines sort of, really work in action. As Keith explained, I was part of managing a really devastating outbreak at a Waypoint that afflicted some very frail older adults and who got extremely sick. We didn't know it at the time, but we had planned to vaccinate them. And the day before the vaccine happened, they were exposed to COVID. But of course, we didn't know that until later on. They did get the vaccine. Many patients got, very sick very, very quickly. I've rarely seen patients get so sick so quickly, and it was really devastating to watch. And that continued over the first several weeks of the outbreak. It spread very quickly. We were being as diligent as we could in trying to prevent the spread, but it was still happening. And then we started noticing that the longer it went on and the more time that the vaccine had to take effect, that all of a sudden, instead of getting really sick, the patients were starting to get more mild illness. And then by the time we gave them the second dose and there was a little bit more time that passed, then we just saw that patients stopped getting sick at all and occasionally would test positive, but most of the time wouldn't even test positive. And then the outbreak came to an end. And I'm quite convinced that the vaccine really changed the way that the whole outbreak sort of ended. And I think we would have had a lot more patients that were positive and a lot more deaths if it wasn't for the vaccine. And so, after sort of seeing that in real life, then I was already convinced that it was great, but I'm even more convinced now than I was before. So I just want to give a little bit of background about, what vaccines are out there, what the technology is, sort of how they work. I think it's really important as you're making a decision about whether to get the vaccine or not to really understand what the science is behind it. And then you can sort of understand and sort of assess for yourself all of the various information that's out there, because there's a lot of information that's out there and some of it is better quality than others. So there's 4 vaccines currently. There's 2 different vaccine technologies. But there's more similarities between the different vaccines than there are differences. The overall approach to how the vaccines get the proper information into your body so that your immune system can learn how to fight the COVID virus is quite similar. So essentially, all of them have some form of instruction set that is then delivered by one mechanism or another into the cells. The cells make a very small piece of protein, which is just a component of the COVID virus that is normally found on the surface of the virus. Your body makes a small piece of that, which allows your body to learn how to recognize the COVID virus. But at no time is the whole virus ever put into your body. And so there's no chance of the virus spreading or of you getting COVID from the vaccine. You're only getting one very, very small part of the overall virus, but it's enough that the body can learn how to fight it off. And it very importantly sort of protects us from getting, really serious illness or death or anything like that from it. And so they work very well, as I talked about before. So the first of the 2 types of vaccine technologies is the mRNA vaccines. These were the first ones to come out. The 2 major companies that make it are Pfizer and Moderna. And essentially, what they have inside of them is an instruction set that's made of some genetic material that's called mRNA. So mRNA is just an instruction set that tells your cells how to make the particular protein, but it's very sensitive to getting broken down in the environment. And so it's put inside special coating. It's a very similar coating to the coating that our cells have in our body. And that transports the instruction set, into your body. It delivers it into the cells where the protein is made, and then the body learns how to, recognize and fight off COVID. This particular technology has actually been around for several decades. There's been several clinical trials looking at cancer and looking at several other viruses and delivering vaccines. It's never been brought to market, as a full treatment like these vaccines have. But in fact, there's a lot of experience with it. The difference between sort of that experience over the last 20 years and now is that in the last couple of years, there's a lot of new technology that's been developed around mRNA and keeping it stable. And we have a lot of availability to do things that we didn't have previously. And so all of a sudden, what was not a viable option before has become sort of a current technology. The downside to it is that because the mRNA is not as stable, because it breaks down more easily, then it's harder to transport. It has to be kept colder. That's sort of the downside of that technology. The second sort of type of vaccine is what's called an adenovirus vector vaccine. The adenoviruses are essentially sort of the virus that causes the common cold. These particular adenoviruses are not taken from the human common cold, but from other sort of primate sources. And they're designed so that they can't spread. So that particular virus that's in the vaccine can't replicate, it can't make copies of itself. Its only job is just to deliver that instruction set into the cells, and it does that in a very, very efficient way. The instruction set, instead of being mRNA, is DNA. And DNA is sort of, it's like having a printing plate where you can, the DNA can make many copies of itself, and it makes mRNA, and then the mRNA, which is the same instruction set that is in the other vaccines, then tells your body how to make the proteins, and you can see how similar they are. They both have specific technology designed to deliver the instruction set to the cell. They both make the protein. They both teach the body how to fight COVID. Again, this particular series of vaccinations, because they have DNA in them instead of mRNA, we can keep them at lower temperatures. They're much less susceptible to being shaken, and they don't have to be handled as carefully. So they're easier to sort of move around and get into different populations. And that's why you've seen us use the two different vaccines in different ways. And some of them are brought out into clinics that are further away from where they're stored. Some of them are kept closer. Some of them, it can be used, right in pharmacies and that type of thing. And so that's one of the biggest differences. But the important thing is that all of the vaccines are quite safe and are quite effective. So just talking very briefly about them being effective, we've all seen data or heard about data from the trials that when these were first being tested, and we know that the efficacy rates or the success rate was very, very high for all of the vaccines. But what I think is most relevant is that one of each of the types of vaccines was used in the UK population, and they started vaccinating way before we did for a variety of reasons. But they actually have collected data now from real world, from not just people that participated in a clinical trial, but just the everyday person that's been vaccinated. They looked at how often people got COVID with the vaccines and without the vaccines, and they could look directly in the same population, how one vaccine compared to another. And so interestingly, there wasn't that much difference between the two vaccines, which is the first point. They both worked extremely well. And the second point is that in that UK population, they all had sort of, just one dose of the vaccine. There was a few people sort of towards the end that had a second dose, but most of the people just had one dose that still worked very well. And the major outcome was that the number of people that died or that had really serious illness requiring hospitalization went dramatically down after the first dose. And so even though we could toss around, how many people actually got COVID and how many had minor symptoms and how many people didn't have minor symptoms and all of that, there are differences between some of the vaccines when you look at some of that sort of more minor data. But when you look at the really important fact of who gets sick, who goes to hospital, who's going to die, they're very similar and they're both extremely effective. And to me, that's what the most important thing is, because that's what's going to keep our hospitals open. That's what's going to make us be able to get through this. It's not whether or not you get a sore throat or a headache. It's whether or not you get sick enough that, you're needing hospital and other treatments. The second thing that's been raised, and we'll talk about it throughout the evening, but there's been a lot of sort of concerns around safety of these vaccines. So these vaccines are some of the safest vaccines that I've ever dealt with in my career. Many of them have some minor reactions, especially after the second dose. A lot of them are just the typical reactions of what you'd expect when the immune system is working, and it just tells you that your body is recognizing it and it's making an immune response. People sometimes get fevers or body aches and things like that, but they're usually very short-lived. Sometimes people get a sore arm and things like that, but they don't last very long. They're very minor and they go away. The number of people that have had really serious reactions to the vaccine are extremely small. The most serious reaction is an allergic reaction that every vaccine clinic and every site where they give vaccines is prepared to handle. They've got epinephrine, which is like an EpiPen available that they can give to people. And even after giving sort of like millions and tens of millions of doses throughout the world, there's only a very small handful of people that have had those kinds of reactions. So overall, I'm very excited that we have such a safe, effective treatment, that it's widely available, that we're able to offer it to people. And I think it's just a great time in the pandemic to sort of, look at, the fact that we're on the brink, if we continue doing the right things, of hopefully bringing it to an end. So with that, I'll pass it back to you, Keith.
Kevin, I'll just carry on a little bit. We've had several viewers write in and are concerned about the duration of time that this has been on the market, and actually from the time of development to the time of putting it in people's arms, it's a reasonably short time period. And how long it takes to get a new drug to market, it's years, it's not months, the way this one came along. How do we address those people who say, well, we just don't know the long-term side effects, the long-term sequelae? How do you respond to that? And Colin, feel free to jump in too.
Yeah, so I think about that in a couple of different ways. The first thing that I think about is, was there protections that are normally in place when a drug is developed that were sidetracked or fast-tracked, sort of in this case, and all of the normal steps that are required in order to test a drug and make sure that it's safe were done in this case. But because these were, really urgent vaccines to get on the market, several of the steps that would normally happen one after another happened simultaneously, just so that we could sort of speed things up. But all of the steps were taken. I think all of the various agencies of the world have looked very carefully at the data and really analyzed it. We've had very large studies with very large numbers of people, much larger than we'd have for a lot of the medications, just to show us that it's safe and to show us that it works. We've now had millions of people around the world who've been given vaccinations, which is much more than most medications at the beginning. And so that gives us a real sense that it's safe. And the vaccine is gone from your system, very quickly after you get it. And then it's just the immune response that's left. And we have lots of information on, how vaccinations work and immune responses work. And what we know is that once your body makes the immune response and once the vaccine is gone, that vaccines don't tend to cause any problems sort of later on in life. And so for all of those reasons, we're quite confident that it's very safe. The flip side to it is we have to look at, what is your chances of getting COVID? And there's a lot of downsides to COVID. It can cause permanent damage to the lungs. It can cause permanent damage to the heart. Some people, pass away from COVID or get really sick from COVID. There can be blood clots and strokes and all kinds of things from COVID itself. And so, COVID's dangerous to get. We all know that. But, overall, there's no question in my mind that it's much, much safer to get this very safe vaccine than it is to sort of take your chance that you'll get COVID, because there can be sort of long-lasting effects from COVID. And as far as we know, no long-lasting effects from the vaccine. So with that, Colin, please feel free to chime in with your comments.
Sure.
Could I ask you to specifically address some of the concerns with the AstraZeneca vaccine, which has been in front of all of us? And I hear people saying, that's the one I'm not going to have. Should we be concerned about the safety of that particular vaccine?
So whenever we have new vaccines, or even vaccines that we've had for a number of years, it is very normal for us to monitor very closely any kind of events that occur, during the number of days after we're immunized. And because there's so many people being immunized, obviously there'll be certain events that will occur that would have occurred if that person wouldn't have been immunized. With respect to the AstraZeneca vaccine, they did see a potential signal of blood clots. They have looked at it, and at this time, and they continue to look at it, the consensus is that it is a safe vaccine. When they look at the number of people getting blood clots following immunization, and we have lots of people getting immunization. I think it's about 400 million doses of COVID vaccine already worldwide. The rate of blood clots for those immunized is not any higher than that of people who are the background rate, or the rate of people who are not being immunized. So we know that the risk is not increased that way. But because we are monitoring it very closely, it is coming to the forefront. They continue to look at it, and there is at this time a potential concern, I should say, as they look into it, that the vaccine may cause platelets to decrease somewhat, and that may cause blood clots. It is not causal right now. They are certainly looking into it, as we would normally do when we see a potential signal. And at this time, it looks like that potential theory would be in the age group of under 55 years old. For the AstraZeneca vaccine, at this time, we are providing it to those that are 60 and over. And we don't see a signal that way for those who are older. So, rest assured that, we are taking these potential signals very seriously. But if there is a risk, the risk is estimated anywhere between 1 in 500,000 to 1 in a million. It is a very, very small risk. And again, it is not. It is a potential risk at this time as they look further into it.
So one of the things that people have brought up, I put it in the safety category, is how do we know how long it lasts? So, if you have a vaccine that only works for a short period of time, then really it's safe up until that time period ends. So how do we know how long these vaccines last for? And then the other part of that is, and since a booster is, most people have said a booster is required, what is the right timing for the booster?
So that's a really good question. I mean, we have a wealth of experience and with multiple vaccines we've had in the past where there is multiple doses, hepatitis A, hepatitis B. And so we know a lot about the immunology of vaccines. And we know that when it's a multi-dose vaccine, such as for the Moderna and Pfizer vaccine, 2 doses, historically, and from our experience, after the first dose, the protection doesn't go down quickly. That's one. Second of all, as Kevin had mentioned, we have real life data now, real world data, where people in the UK have had the first dose, and after 2 months, their protection was very, very high. upwards of about 80%. And so, given all that, we should be confident that after 2 months and up to 3, up to 4 months, that initial protection should stay high. And then second of all, we know from our previous experience with previous vaccines, if you delay the second dose, generally speaking, the maximum protection that you get later on and the length of protection after the second dose rivals the regular interval that would be given between the first and the second dose. So given all that information, and given that if we delay the second dose, we can provide that extra protection to people who haven't got the first dose, that is certainly the recommendation from our National Advisory Committee for Immunization.
Okay. There's a question just came up on the feed, and it's kind of relates to this too. Will we need future vaccinations to deal with the variants or the decreasing effectiveness of the current vaccines?
Yeah, I mean, I think that's a really good question. I mean, if you look at influenza, by definition, is a variant every winter. It changes, and unfortunately for us, we haven't had an as effective vaccine against the influenza as we have against COVID. So I would say there is a fair likelihood that we will need to be re-immunized at some point in time, maybe on a yearly basis. And in fact, we have the vaccine manufacturers working on variant vaccines as we speak. And the beauty of it is, because of the way the vaccines are currently made for COVID, particularly the mRNA vaccines, they can make that change a lot easier than our hamstrung sort of influenza vaccine technology that's still based on chicken eggs, unfortunately. So yes, we might need to be re-immunized, but we have the technology and the ability to do it quite quickly. I think Kevin, certainly is much better versed in immunology and might be able to comment a little further.
Kevin?
No, I agree with everything you said, Colin, and I think that's one of the really exciting advances of these vaccines. This technology was invented in order to try to fight some illnesses that we don't have technology against, like HIV and other types of viruses that we just don't have technology. And it just happened to be the right time that we could use it for COVID. But it's exciting because we can make new vaccines quickly. We can adapt quickly. We know that they're safe. We can test them quickly. And so, I think it's a great time to that we have this technology and that we can sort of use it, and it makes a lot of sense. But I still don't think it changes the overall decision about whether to be vaccinated now. I think the answer is that the variants that are in our community right now, the vaccine works very well against almost all those variants, and certainly the ones that are prevalent. It works extremely well for all of those. It's the same makeup that we have now that was in the UK when all of those all that data was collected that I talked about earlier. So we know it works. We know it works now, and if things change in the future, we know that there'll be technology that we can, try to catch up as quickly as possible. So, so I think that's exciting.
Kevin, you mentioned anaphylaxis as being one of the side effects potentially for any of the vaccinations. Can you delve into that a little bit more? Because everybody's definition of anaphylaxis is just a little bit different. Some people might think that, some mild wheezing and feeling faint is an anaphylaxis. Other people might say, take me to the hospital. That's real anaphylaxis. Can you tell us what you would call anaphylaxis, that people should get concerned and notify people, and what can you do if they are truly have this tendency to real anaphylaxis?
Yeah, so all great questions. So let me talk about, first of all, what anaphylaxis isn't. And so sometimes when you get an injection in your arm, it might be sore. You might get a little bit of a rash in your arm. And that's not serious. You may even get a little bit of hives, but if your blood pressure is normal and you otherwise feel right, then there may be nothing that we do, or we may give you a Benadryl or something like that for it. A true anaphylaxis is the body sort of overreacting to something. So it's just the same as somebody who's allergic to peanuts, and they all of a sudden, they're exposed to peanuts, their body sort of knows what peanuts look like, and then they're exposed again, and the body overreacts to it, and it may cause you to have trouble with your breathing. It may make your blood pressure go low. You may lose consciousness if you have enough trouble with your breathing. And, for all of those types of sort of reactions, then we give people epinephrine, which just helps the body to turn off that part of the immune response. It helps the blood pressure to come up. It helps the airway to open. It can work very, very rapidly. And so people are trained in the clinics so that if they see minor reactions, like, minor rashes and things like that, they watch them very closely. They check your blood pressure. They make sure that it's not turning into anything more. If it is, then, epinephrine, given once, if you're not sure, is still relatively safe. And then somebody could go to the hospital and have more monitoring there to sort of make sure that they're safe. Even that is very rare, but we would always err on the side of giving it if we weren't quite sure. But once that sort of, initially that 15-minute of monitoring period is over, then it's very unlikely that your body's going to react after that, because these are reactions that occur because you've been exposed to something similar to that previous in your body, and then your body reacts very quickly. So very unlikely that you're going to have a reaction. So that's why after 15 minutes of monitoring, we let people go home. Of course, some people might faint or pass out after a vaccination, but that's often more just the anxiety of, the vaccine itself. And it can, we've seen sort of fainting and many other conditions, and not related at all to anaphylaxis or what we're talking about here. But overall, I mean, it's something that happens with all kinds of different medications, all kinds of different vaccines. It's something that medical professionals are aware of. We know how to treat, and I think it's a very extremely small risk. Generally doesn't cause any long-term harm, and for the amount of benefit that we get, then I think it's a very small issue that we have to deal with as healthcare providers. But I don't think should stop people from being vaccinated. If you've had an anaphylactic reaction in the past, then it's important to disclose that. Not because you have an increased risk of having anaphylaxis with the vaccine, because unless you've reacted against one of the exact components that's in the vaccine, it's still very, very low chance that you're going to have a similar reaction. But we do monitor people a little bit longer in those circumstances, just to be on the safe side. But in fact, I've never heard of anybody who's been monitored for longer and developed symptoms later. But we just do it just to be careful, because a few extra minutes for safety just makes a lot of sense.
So one big question that a lot of people have, and I'll put it in the safety realm, is around pregnancy and kids. So right now, or initially, the recommendations were very clear that to use it in those two populations was problematic. And so I think people extrapolated that the current vaccinations weren't safe in pregnant women, and they weren't safe in kids. Is that a myth, or is there something that we need to know more about that?
I mean, yeah, that's certainly a myth. I mean, with any kind of medicines, new medicines, including vaccines or drugs, we, in general, those trials are done on healthy persons and adults, not generally done on children, not generally done on pregnant women as a precaution. And what typically happens then is, after it's licensed and it's been used for a while, some women will, first of all, will receive the vaccine unknowingly while they're pregnant. I mean, let me rephrase that. They're not, they don't realize they're pregnant, and they receive the vaccine. And that's part of the monitoring that occurs. And also, after a certain period of time, trials are then done on other populations, like children, pregnant women, as well as persons with medical conditions. And that's what's happening at this time. There are trials that are occurring. For pregnant women, I think what has been decided really as a consensus with medical professionals is that the risk of COVID at this time far exceeds the theoretical risk of the vaccine for pregnant women. And I say theoretical because pregnant women can receive a number of vaccines during pregnancy, and it's never been a problem. Pertussis, tetanus, influenza, and therefore it's really quite a strong recommendation for pregnant women to get the vaccine. For children, there are currently trials that are undergoing, and given that they are generally at lower risk than the rest of the population because of their age, we will be able to immunize, I am sure, children in due time when their priority time comes up.
Okay, thanks. That's very helpful. Colin, I'm going to pass it over to you for the rollout plan, something that has essentially evolved over 3 months maximum, and has a goal of immunizing 80% of all our entire population. So that's 400,000 people in Simcoe County. And how many people in Ontario? That's about 12 million people in Ontario. That's a lot of people. I don't think we've ever seen a program like this before. So roll out your version, the complete version that we have now of what does the rollout program look like?
Yeah, I mean, it's, I think one thing that we're really working towards is speed as well. It's just not a matter of immunizing that many people, but in as fast as pace as possible, given that the COVID infection is alive and kicking at this time. So certainly the rollout of COVID immunization is certainly, for me, one of the most important mass immunization campaigns in my lifetime. Some of you will remember or know of the introduction of the smallpox vaccine and its eventual worldwide eradication of smallpox in 2011, the invention of the polio vaccine in Canada and its eradication from most parts of the world now, and other vaccines, notably measles, where just up to 1980, there were 2.6 million deaths a year worldwide. 2.6 million, mainly in children under 5. And because of the vaccine, it has dropped to a low of 73,000 in 2014. And because of recent years of decreased immunization rates from vaccine misinformation, hesitancy, political and economic instability in some countries, it has increased back up to about 140,000. So vaccines have a history of saving a lot of suffering, and this COVID campaign is no different. The good news is that at this time, as Kevin has outlined, there is an increasing number of different COVID vaccines, and the total number of doses available to Ontarians, compared to the start in late December, is increasing with every week. And it looks like we're in good hands in the next number of weeks. So first of all, for all of you, how do you know when you are eligible and how to register for your vaccine? The best place to go to is our website at the Simcoe Muskoka District Health Unit website at www.smdhu.org. All the information is there, and it's basically changing as we weigh the balance of how much vaccines coming in and who is next on the provincial priority list. So if you haven't heard, as of today, adults from 70 to 74, those who were born in 1951 or earlier, they've been added now, as well as all remaining healthcare workers. So for them, you can now pre-register for an appointment through our website. So they join all the other older adults, all the other healthcare workers, essential caregivers of residents in long-term care and retirement homes, adult recipients of chronic home care who are already eligible for a number of weeks. And of course, Indigenous adults and their urban or in First Nations communities have also been a priority group since phase 1. And So basically, once you've pre-registered on our HealthUnet website, you'll be placed in a queue to receive a vaccine appointment. This is for the newly minted 70 to 74 age group. For those who are 75 onwards, you can register at the provincial website directly. Just right now, the province can't register those who are 70 to 74, partly because we in Simcoe Muskoka are just a little bit ahead of the pace. We're able to provide that the vaccine to that age group. In any case, if you go to our website, everything will be explained there and it will be pointed to you. You'll be sent an email invitation and the first and second dose appointments will be generated at that time. As Keith mentioned, we've given more than 73,000 doses of vaccine in Simcoe Muskoka with a population around 550,000. And we hope to do a lot more moving forward. So we have about somewhere from
for a second, because one of the constant questions we keep getting
no problem
is I either don't know how to use a computer or I get in and I'm not sure I'm entered the right thing and I just need somebody to talk to.
Yeah.
How easy is that to make happen, or how do you suggest that?
Yeah, so if there's any issues at all in terms of you're having problems on the computer or it just doesn't seem to be working, you can certainly give a call to the provincial hotline. There is a provincial line where you can do the booking there, or you can call us directly and we can certainly help you. I know there are some communities where you know, some libraries are helping people to register, people who don't have a computer. But certainly if there's any problem, certainly give us a call, give the province a call, and we will make it happen.
And talk about it with your neighbor. Talk about the other guys that have been successful, because you know, it's like any computer program. It's never straightforward the first time. That's
right. We've you know, obviously with a large program like this, there's had been some hiccups, no doubt, but that's improving.
Okay. Yeah, I'm sorry.
No problem. So so we have about 10 to 15 these mass immunization sites throughout Simcoe Muskoka. And what we have also at this time is a pilot program with 9 primary care groups or family health teams, where they are identifying people who are age 60 to 64 to give the AstraZeneca vaccine. And they have provided about 4,500 doses. So that is a pilot program, not in all the province, but certainly in some of our areas. I will ask you not to call your healthcare provider, because they will call you if you are eligible. And not all healthcare providers have it. I mean, we hope in the next number of weeks and months that more and more healthcare providers will be able to participate. There's also the question about pharmacies. I mean, pharmacies are great to get our flu vaccine every year. They have there's lots of pharmacies, obviously, and they certainly have the expertise to do it. There are pilot programs of pharmacies in 3 different regions in Ontario. Unfortunately, we were not part of it at this time, but I do foresee in the next number of weeks that we will have pharmacies that will be providing the vaccine as well. So I think this is all, you know, looking at the up and up, but I do ask everyone to be patient. I think, you know, one question many have, and, you know, when you look at the news, you know, why is it taking so long for Ontario and Canada to immunize everyone? You know, why can't we be as quick as Israel, you know, who has now, you know, immunized, like 60% of their population has received at least 1 dose and 50% of the population has been fully immunized. You know, I mean, having been involved in the rollout from the beginning in late December, I know I can describe some of the challenges we've faced from the beginning at this time. And I think Kevin has alluded to some of it. You know, first of all, at the outset, when we received only the Pfizer vaccine, we were hamstrung by 2 things. We had to be, the vaccine had to be used at the site of where the vaccine was stored. This was because the vaccine was quite fragile to movement. They don't want it to be moved at all. And also it had to be stored in an ultra cold freezer at like minus 60 degrees. So in Simcoe, Muskoka, there was only one location, and that was the Royal Victoria Hospital. And of course, the other issue was there was a very limited supply. So as much as we wanted to bring the vaccine to the most vulnerable, which were the long-term care home residents, we couldn't. And it was near impossible to bring them to the site to be immunized. But as soon as we learned from Pfizer through their trials that we could move it, and they made it specific, you can only just move it once while it was thawing. At the beginning of January, we moved to immunize all the long-term care homes. We were still constrained though, because once it was thawed and reconstituted, we only had 2 hours to use the vial. And this is quite different from all other vaccines that we normally have, where, you know, we send it to the family doctor, to the pharmacy, they put it in their monitored fridge of 2 to 8 degrees, and they have 30, 60 days to use it. This was not the case. And so we were really, really in a tough bind to, along with the vaccine supply. But having said that, that's all past us. The vaccine supply has greatly increased, and we now have many other vaccines where we can be stored in a normal freezer, a normal fridge. You know, we can put it into a syringe and bring it out to someone. And so since March the 1st, we've had these community clinics involving some family health teams and primary care providers. And we look forward to having more of that, more pharmacies being involved. You know, at that time, our supply was difficult to predict. I remember at the morning call at 8 o'clock, we had to decide, the 100 doses, where it was going to go, or they would inform us that it was not coming anymore. Mm-hmm. So it was truly a difficult task. But I think that's behind us, and we are looking forward to more and more vaccines, and we will go as fast as the vaccines arrive. So I think
common questions coming through here. Colin and Kevin jump in too. I think they're short answer questions, but somebody says, I don't have a car. I can't get to the site where they're being delivered. Is there assistance with transportation?
Yeah, so from my understanding, certainly I think different communities have had organizations come up with transportation solutions. I know that in Barrie, the Barrie Special Transit System is providing transport. So I think we are now working with a number of different organizations to ensure that people can get to the immunization centers. If you can't get to them, certainly give us a call and at the health unit, and we will hook you up with a possible transportation solution. I think also in the next couple of weeks, we're looking to working with some healthcare professionals as well as our EMS partners to bring the vaccine to those that are really homebound. That they even if you had transport, they can't leave the house. So we're looking forward to that.
The other question on travel is from a totally different direction. Is right now, or up until about a week ago, York County introduced vaccinations to those between 70 and 75, and up here we didn't have. Could I have gone to York County? Or if I was 62 and there isn't any pharmacies up here giving, can I go to Toronto to a pharmacy to get it? Well, what is the policy around travel to get the vaccine?
I mean, that's I think a really tough question. I think, in general, those appointments, those places are for the residents of that area, whether they be primary residents or secondary residents or people who work there. But certainly, I think, if some people who live very close to the border, they travel a lot to that area. I think the idea is that we have many borders, and as we get more and more appointments available, the most important goal is to get vaccines into arms. And if you have to get an appointment elsewhere and you can get it, I would go ahead.
Okay, thank you. Question around OHIP numbers. It's been particularly relevant in some areas, and I think it's relevant in some areas in Simcoe County. Workers have come from other countries here, come on a temporary visa, and they're still here and don't have an OHIP number. Will those people, who I think most of us will admit are potentially at risk, will they be excluded because they don't have an OHIP number, or how do we go around that?
No, not at all. We want to immunize everyone who is in our area because they potentially can fall ill to COVID as well as transmit it. So no, we will not exclude them. They can certainly get the vaccine.
Okay. The other question was around scheduling of the second dose. And there were several from people that said, well, I had my injection fairly early on. This is the 80-year-old group. And I got an appointment for my second dose. Is that going to stand, or is that going to be changed now? So, or I don't have an appointment for the second dose. How do I get it? Like there's some people that seem to have fallen through the cracks on that second dose. It's really straightforward right now if you're booking now, but to go back and collect them, how's that going to get resolved, or how big a problem is it?
Yeah, so what happened was, I think on March the 10th, the provincial policy did change in order to ensure a wider coverage of first doses, that regardless of when you got your first dose, with the exception of like long-term care home and retirement home residents, that your appointment would be deferred until 4 months later. Certainly emails were sent en masse to people who already had a second dose appointment, informing them of that, and that when the time comes in 4 months from now, from the time that you got your first dose, either the immunization center will be contacting you, or there will be a general message on how you would be able to book your second dose.
So you're aware of that challenge for some people that were kind of caught in the middle there?
Yeah, it is. They had to do a cutoff, and that was the decision. Yeah.
Okay. It's an interesting one just come up on the screen here from somebody. My doctor said that they cannot search patients by their age, and so people shouldn't be waiting for a call, as it will not come. I think that's true. Go ahead. You're the expert.
Yeah, I mean that's unfortunate. They can't search it by age. I assume they might have more of a paper-based record. Certainly,
I think what he wanted was if the doctor's office could call all patients that were in the different age groups when their turn came up and tell them to get the vaccine. Is that going to happen?
At this time, if you are, 75, you just go straight to the provincial booking system.
Okay.
And I think as the numbers go down, 75, 70, as we are now, 65 to 60, certainly you can independently make that appointment.
Okay. Quickly tell us the biggest challenges you think we're facing right today with the rollout, and a couple solutions if you've got them, or maybe you've already figured them all out, Colin.
Yeah. Our biggest challenge is supply. We just can't get enough vaccine, we are ready to give as many vaccines as possible per day. I think we're ready to give up to 6,000, 7,000, 8,000 vaccines per day. And, the picture is pretty rosy. There's 4 different types of vaccines that have been approved. And, obviously from the vaccine company point of view, they want to ship it fast, right? This is just their business. They want their vaccine to be used. So that helps us. So I think it can only get better. And I do want to say that everyone has been very patient. I know everyone wants and deserves their vaccine yesterday, but I urge everyone to be a little bit more patient. And in the next number of weeks and months, everyone will get a chance. No one will be forgotten. We won't forget you. If we forget you, you let us know.
Okay. Okay, good comments. Thank you. Next category was what happens after I'm vaccinated? That has generated a huge number of questions. Do I still need to distance? Do I need to wear a mask? What can I do differently after I've been vaccinated that I can't do today?
Well, I mean, at this time, first thing to do is go, woohoo! That's what I did when I got my shot a couple of weeks ago. I think we're on a bit of a funny time, unfortunately, because unlike some other countries, I think the US, they've had a 25% coverage of fully immunized. Like I said, Israel, 50%. We can have a view of what that might be like. They're certainly relaxing some of their restrictions. But at this time, given that we've had about 8% of our population receiving only the first dose, albeit a very effective first dose, I think we still have to be quite vigilant, continue with our public health measures until we get a certain amount of coverage. And we're looking at, likely 60, 70%. And I would say likely more 2 doses rather than 1 dose, but we'll see. The science from the real world experience from the UK, who is about 2 to 3 months ahead of us, will let us know how well we're doing with the first dose. But I think, eventually, at some point in time, we will be able, to do the very simple things like hug the people whom we love and whom we have not hugged for a year or potentially for a year. We will be able to do that, but it is not now. I don't see it as being even the early summer. I see it as we're looking at the fall. Because we have to remember that we have to get our kids immunized as well, and we have to get the second dose in as well. So rest assured that we're all want to relax some of those very painful and economically devastating, emotionally devastating restrictions, but it is not in the near number of weeks or next month or 2.
Kevin, you've been quiet during the rollout. Thank you. This is your chance. Do you want to, because you're sitting back and watching Colin's activity, but I'm sure you've been involved in the rollout plan just as much as everybody else. What's your thoughts on the rollout?
So yeah, absolutely. Well, let me start with your final question, because I think there's some very interesting nuances to that. In my world, as a doctor who looks after older adults, I'm very concerned about congregate settings like retirement homes and long-term care homes. And, I think in many ways we've underestimated the effect that it's had on that population. Obviously, those people were hit really hard by outbreaks. That's where the majority of the deaths in the province happened. For very legitimate reasons, we had to, be very strict about who could come in and who could come out and what activities could happen. And for all of the same reasons, that was the first group who was vaccinated and who the majority of whom have had now 2 vaccines in our region. And so I think we need to do some really hard thinking about, what does that look like in those communities? How can we start to very safely, very gradually sort of open up those communities, in the long-term care homes, the retirement homes, so that they can get back to something that resembles more normal life, so that they can have more social interactions, so we can break the isolation. And, a lot of individuals in those circumstances have, given up the will to live and just feel like it's not worth it anymore because things have changed so much. And that takes a tremendous toll on somebody's health. And so now that they've been vaccinated, we have to sort of think about that, but we don't want to just go to the other extreme and say, okay, we've come this far and now let's just, go back to normal and not be careful. And, recognizing that although those communities, those micro communities are vaccinated, the other people in the community around them are not as vaccinated. And so, so it's very, very difficult, but I think it's very exciting that we can start to, look at that. And I think, as we have some success in those communities and as we see what it feels like and how we do it, then the rest of the population will start to catch up and we'll get vaccinated. And then we'll slowly start to sort of come back to normal. But the other thing is that I don't think this is going to be like flipping a switch. I don't think we're going to all of a sudden say, okay, we're vaccinated, life is normal, like we did it. I think it's going to be a very gradual change where we say, okay, now we've got more people in the community that are vaccinated. We can start to relax some of the restrictions, but we can't go completely to normal. And if that goes well, then we can go to the next stage. And I think we can just slowly sort of open up. My worry is that, for the last year, we've given up like huge aspects of our life. We've made tremendous sacrifices to keep each other safe, to keep the vulnerable in our community safe. My worry is that when the vaccines come, we're going to forget about all those sacrifices we made and just be so excited to move forward that we're not going to be careful enough. So, I think it's all about finding the right balance. But obviously, it's a good problem to have. But I think we still have to be careful with it, but to be excited that life will gradually come back to normal.
Okay, thanks. I'm going to take a pause here. I've got, just before we start our question and answer session, I've got a story to recount. I want to thank the sponsors and tell you a little bit about the next program. So a gentleman called me yesterday, and I say hats off to him because he wanted to tell me a story which he thought would be relevant to our discussion tonight. One of our local residents here, he was enjoying last weekend's wonderful spring weather, and uncharacteristically, because he'd been pretty safe, but nice day, he invited a neighbor over to discuss a home renovation project. They were outside, they were on the deck, they were unmasked and somewhat distanced, he said. So the story doesn't end there. Later in the day, he and his wife sat down with the same neighbor and his wife for drinks. They again were outside, reasonably distanced, and he said, maybe 5, maybe 6 feet, maybe. And but all were unmasked at that time. So beautiful weekend, enjoyed it, had some discussion with friends. 2 days later, the host couple were called by the neighbor who told them he had tested positive for COVID-19. Now the story gets pretty serious. He and his wife are isolating at home. They're in full quarantine. And as expected, they're worried about their health. The vaccination appointment that they had scheduled for this week had to be postponed because of quarantine. So our key message in all this is just a sobering thought. Don't let your guard down. Please stay vigilant, observe physical distancing, wash your hands, wear a mask, and get a COVID test if there's any doubt. Happy if you want to add something to that, Kevin or Colin.
I think it's a great reminder, and we need those reminders because we're all desperate to get back to normal life. But it's a great reminder that, if we've come so far, we've made so many sacrifices, but we are in a third wave. We do have variant COVID that's out there. I can tell you firsthand, variant COVID spreads faster, even with care that prevented regular COVID from spreading. The variant COVID seems to, be less forgiving than regular COVID was. And it's in our communities in Ontario. It's out there. We can get through it. It's just a wave if we do the right things and we continue to get vaccinated and we continue to follow the rules. We can get through it, and we can be successful. And then I think things look much rosier after that. But I think now is not the time to let down the guard. And I think that's a great illustration of one sort of moment like that, as important as it was, but then can have consequences afterwards. So. Mm-hmm.
Okay. At this point, it's my privilege to thank our sponsors. TJ, I think you've got the slide up. I just can't see it. We have 2 very large healthcare organizations, both who have vaccinated the majority of their staff, and at least at Hillcrest, the long-term care home, all of their patients. Those 2 sponsors are from Georgian Bay General and Gail Hunt, the CEO there, and Hillcrest Village Care Center with Walter and Jonathan Enns at the helm. We have 2 individual healthcare providers who give us lots of support. Dr. Anita Federici and Associates, now called the Center for Psychology and Emotion Regulation, and Audia Hearing Aid Centre, who have hearing aid clinics throughout Simcoe County. These four sponsors are joined by LabX Media, who have a large presence in the scientific community and offices here in Midland. The Lipton Group, Lois Lipton and her group of real estate brokerage, investment, and development companies, and Mink Insurance, which is now part of the McDougall Insurance family. To all seven of you, thank you for your support. Thank you for making these programs possible free of charge to our entire community. We truly appreciate that you're with us as a team. Little bit for our next program. It's in the middle of Mental Health Week. When's Mental Health Week? Get your calendars out. Okay, so it's the first week of May. On May 6th, please join us for mental health and addictions in the time of COVID. Hear about the effect of COVID on eating disorders, family issues, and lives of those who've been providing frontline services. Very timely topic. Look forward to seeing you all on May the 6th. So let's switch to our question period from you in the audience. I've been keeping track and I have multiple lists around me. So I'm just going to go to some common things because one of the things tonight, we have so many questions. I can see which ones are bothering people the most or most relevant here. So some very pointed concerns around vaccination centers, taking people out of order. They're not going in the order of their appointments. They're going in the order of how they show up. Sometimes there's been a 2-hour wait, congregate setting, the challenges with that. What are the guidelines around waiting time and appointment times, and what are you trying to achieve?
Yeah, so I mean, we're trying to get people in and people out as quickly as possible. And what we really want people to do is try to stick to their appointment time, because as you can see from the question is, if you arrive half an hour early, you're going to make someone else wait a little longer. And we can't line manage those who arrive early easily. Because we want people distance, we want to get people in as quickly as possible. So there's some responsibility on people's parts to come in on time. Admittedly, early on we had a couple of hiccups on long lines, but we're constantly improving on that. And as far as I understand it, those very long waits that some people have experienced should no longer be there.
Okay, thank you. Thank you. My wife has a severe allergy to non-steroidal anti-inflammatory drugs. Would it be safe for her to get a vaccine?
I mean, I can jump in here just by starting to say that, any advice that we give, obviously, through the TV and through Zoom has to, not be specific to the person, but just in general. But, in general, the only reason why we would not want to give the vaccine is if you had an allergy to a component of that vaccine. If you have an allergy to something that's not a component of the vaccine, then there's no specific contraindication. But if you're uncertain, or if it's a particularly bad allergy, or you're worried about how you're going to manage symptoms after you're vaccinated, those types of things, then absolutely talk to your family doctor and get some personal advice. But on the surface, there's nothing that I would see that would be an issue.
Okay, thanks, Kevin. Should seniors or people who may have a genetic predisposition to blood clots avoid getting AstraZeneca vaccine? So seniors, I assume, is anybody over the age of 60. I'll be generic here. So should they avoid, if they've got a history of blood clots, should they avoid?
With what we know now, the answer is no. I don't think you need to avoid it. I think, obviously with the blood clot potential signal that we have seen in the AstraZeneca vaccine, it is obviously a concern for people. But at this time, the rate of blood clots in seniors, for those who have been immunized with the AstraZeneca vaccine versus those who are not immunized at all, doesn't seem to be increased at all. So I would, again, given the COVID activity is high, given that in our area, we have about 80% variant, which is probably the highest in the province. I would accept the first vaccine that is able to be offered to you.
Okay, thank you.
Yeah, I would just add to that, Keith, if I can, that one of the many things that COVID does is dramatically increases your risk of blood clots. So the number of people who've had blood clots with COVID is like thousands of times more than the number of people who get it from vaccines. And so if you have that kind of history, I really think what Colin said is really important, and that is get the first vaccine you can, because that's actually going to protect you more from blood clots than any risk from the vaccine itself. And so I think really important to get a vaccine and to get protected and to keep yourself safe in the meantime.
So the next one's a really tough one, but I'm going to say it anyway. So I just said, don't let your guard down. And somebody has written back, don't let your guard down. Yet we are increasing the number of outdoor dining positions. Isn't that mixed messages?
I would agree. It is mixed messaging. I think certainly from my own perspective, this is not the right time to increase the capacity of either it's outdoor dining or indoor dining. We are in the middle of a third wave. So I would have to admit that I do disagree with the provincial policy on this, the direction on this, that, this is the time to really hunker down, to try to get the COVID activity down. And with increased persons with their mouths open, eating close by, it's certainly would increase the risk of transmission. So I agree with with the comment.
Okay, thanks for being straightforward about that. So here's one that we haven't discussed before: is antibody testing. I think back in my medical history here, we have antibody testing now for hepatitis. We have antibody testing for measles. It's fairly common. We don't appear to have any antibody testing for COVID. Is that because it's not relevant, not available enough, or where do you think that's going to go?
Well, there is antibody testing for COVID, except that it's not recommended for the average person. B, and even if you wanted it, it's not publicly funded. I'm sure you can go to a lab who will say, "I'll take your money and here's a test." The reason for it that there's no real good value in the antibody tests is that if it's positive, it shows you've been exposed to COVID, but that's about it. It doesn't mean that you're going to be immune to it forever. You're still wanting to get the vaccine. You still want to protect yourself against a potential reinfection. And if it's negative, well, it only tells you that 2 weeks ago you weren't infected with COVID, because sometimes it takes 2 weeks for the COVID antibody to actually appear in the blood. So you're better off, if you're worried you have COVID at this time, is to get the regular COVID test.
Okay.
Yeah, and some of the antibody testing that we use for other diseases is because they're hard to diagnose through other mechanisms, or we want to make sure that the vaccine has worked. So we don't have data about sort of how antibody tests would make sure the vaccines work. Maybe that will come in the future, but right now we're so focused on making the vaccine that that's a level of specificity that will probably come sort of over time. But more importantly, after you've had COVID, so it takes a while for the antibody test to become positive. So it's delayed until it actually tells you that you had COVID. And then the antibodies can disappear from your body and become undetectable again, even though you've had COVID. You may still be protected from COVID because the body can very quickly start making antibodies again when you're re-exposed, but the test won't pick it up. And so if it's negative, it doesn't mean you didn't have COVID. And so at the end of the day, it's extremely hard to interpret because we don't know, is it negative because it hasn't been long enough? Is it negative because it's been too long? Or is it negative because you were never exposed in the first place? And it leaves you with more questions than answers, which is why we're just not using the technology at the moment.
Okay. Question that's kind of relevant along the lines of antibodies and immune responses is, if I've had COVID, do I need to still have the vaccine?
Yes, absolutely. We would recommend it. We don't know how long the natural immunity will last, nor do we know if the immunity that you have against that particular strain how much of that will protect you against a different strain, like a variant strain versus the garden variety strain or the original strain. At this time, we believe that, one has probably at least 3 months of immunity after your infection. But we have seen some rare reinfections at this time. But yes, still, absolutely. After you've got COVID, once you're feeling well, and once you're past your self-isolation time, please go ahead, get the vaccine if you're eligible for it.
There are some questions here about kids and going to school and everybody or people that they interact with when they're in school. So any indication of when you think children will be eligible to be vaccinated? And do you think it'll start at the higher schools and move down, or just give us a ballpark?
Yeah, I mean, currently, vaccines have been tested on from the age group of 16 and above, and they're currently just doing the trials for those under 16. So they'll be ready in a few months, and certainly the teenagers are more at risk of contracting as well as transmitting COVID, as far as we can see, versus the under 10 age group. So certainly, I think the high school, the middle school kids will be getting it first. And, if all goes well, they might be able to get it in the summer. But if not, certainly when they go back to school in September, I would imagine, they're all there. Let's bring the vaccine to them is how I would plan it if I was the province.
Okay. Tell us about teachers, caretakers, all those other people that interact with students.
Yeah, they've been added to the phase 2 list, which we will be working through. So, we've just started the phase 2, so we're hoping that in the next number of weeks, they will be called to receive the vaccine. Obviously, they're very important for us to immunize, as they're at the front line for my kids, everyone's kids, to educate them, keep them sane, keep the parents sane as well, by keeping them in school. Yes, so we're looking forward to for that to happen in the next number of weeks.
Okay. Do you want to predict on vaccination passports so this gets along, and when will people who are vaccinated be able to have some benefits that perhaps those who are not vaccinated will not enjoy? I think Israel's calling it a green pass or something like that.
I think that's a real tricky one, because there are certain people who are getting the vaccines first and others who are not, and there is sort of an inherent potential inequity there. There's also people who are unable to get the vaccine for a variety of medical conditions, perhaps allergies as well. I think the facts are that if you get the vaccine, the 2 doses or the full series, you're going to be well protected. And, in 6 months, 9 months, next year, that kind of information will be useful in vulnerable sort of settings. So whether we call it a passport or not, the status of one's immunization will be important, not only for the individual, but for the places we go to. I hope we do it in an equitable way, that we do not discriminate, exclude people. But that's going to be that's a real tough question.
So isn't this partly in place, Kevin, in long-term care homes where you have family members who come in to look after patients that they need to be vaccinated that had regular COVID tests? I mean, isn't that kind of a standard protocol that you have in place?
Yeah, so I mean, this is a great question and something that I've been grappling with actually over the last couple of days in terms of what advice that I would give. So at the moment, there are requirements as far as being tested and having regular testing, and there's a mix of sort of rapid tests and the more the sort of more accurate PCR test, which is the one that we get at the assessment centers. But having said that, the vaccines being offered for other visitors and staff in long-term care, but it's not required. And in fact, there's no way that we can currently police it. So people can voluntarily tell the long-term care homes or the retirement homes whether they've been vaccinated or not, and they can sort of informally keep that data. Some homes have been quite successful doing that, but other homes haven't been. But interestingly, we normally keep track of, healthcare workers' vaccination records just to keep them and others safe. And we make sure that their tetanus vaccinations and their other vaccinations are all up to date. And so, there's starting to be some talk about, should we know whether people are vaccinated or not? Not that we would force them to be vaccinated, but, if you had a long-term care home that had a staff with a very low rate of vaccination, then the decisions that you would make about how you would open up and what you needed to do to keep the residents safe there might be very different from a home where you had everybody that was vaccinated and all the visitors that were vaccinated. So I think that conversation will continue. It's a little bit different than the vaccination passports, but I think it's still part of that same concept of, how important is it for other people to know you're vaccinated? There's all of the issues that are involved in it, but at some point it does start to involve, the safety of other people, especially in your workplace, and especially if you're looking after other vulnerable people. And so it's a very interesting ethical question about, where does your right to end and someone else's right to begin? But I think we're going to start to see some movement there, and I think people are starting to get comfortable with, they can know so that we can make good decisions. But it'll be interesting to see.
Kevin, you had some experience with vaccination hesitancy when you rolled out the vaccine program at Waypoint. Some staff and I guess some family members of your patients that were reluctant to agree, because it's voluntary, to vaccination. What were some of the reasons and how did you handle it?
Yeah, so I first saw this in some of the work that I was doing, along with my physician colleagues that were working in long-term care. That was the first sort of group that got vaccinated in Ontario, was the long-term care workers. And what we found is that a lot of individuals there felt that they were guinea pigs. They were being chosen as the first ones to be vaccinated. It was done because they were interacting on a regular basis with vulnerable people, but they just felt uneasy sort of being the first ones to be vaccinated. There was a lot of information on the internet that was incorrect as far as what the components of the vaccine were, how safe the vaccines were, what the long-term side effects were, a lot of the same questions that we've talked about tonight. And what we really found is that it goes back to good old-fashioned sort of, good information, good communications, and trust. And so in the homes where, the vaccine was offered, but nobody spent the time to hear what the concerns were, to dispel the myths, to really help people to understand, to really help people to be comfortable. The rates of vaccination at the beginning was around 30%. But the homes where the docs and other healthcare workers in those homes, did a presentation for the staff, sort of sat down with them, listened to their concerns, did research with them, reached out to experts to get the questions answered. All of a sudden, those homes were 80% vaccinated and had a lot of comfort. So slowly, the homes that had lower rates are starting to go up, but not to the same levels. And so we saw that at Waypoint, and we said, when vaccines come to Waypoint, which they did a few weeks later, we're likely to have the same problem. And so we decided proactively that we would start to do some education with our staff. We would start to hear what their concerns were. I did a presentation for the staff just explaining exactly how the vaccines worked, so that people would understand the technology and it didn't seem so foreign. And with that, people really had a lot of comfort. They took that, they discussed it with their families. I had dozens of people come up to me or send me email messages that said, you know what, I was really scared about the vaccines. I didn't want to get it. And then when I understood what it was and I had good quality information, then now I'm not scared anymore. And now I'm really anxious to get it. And they did follow through. So,
so patience, listening, all those basic things that sometimes when you're in a crisis, you kind of forget. So thanks, Kevin, for that. I'm going to conclude with a quick question to each of our panelists. And let's look ahead to December 2021. That's almost 6 months away. What do you think it'll look like? Give it just an off-the-cuff answer. Where will we be with cases, variants, and the vaccination program?
The most important thing is I'm having a birthday party for my 8-year-old on December 24th because she didn't have one last year. I think, we're going to be in a good spot. I think we're going to have those who want to be fully immunized should be fully immunized by then. I think it won't be business as usual, like in partying like 2019, but we're going to be able to enjoy some of those activities that we haven't had for a long time.
Thanks for that optimistic outlook. Kevin?
So, yeah, I agree with Colin. I think things will look better from a COVID standpoint. I think things will start to get back to normal in terms of trying to prevent COVID, but I think there's going to be a mark left on society for a long time. We've been very isolated. We've changed our outlook. We have done things that we never thought were even possible. And I think we're going to be months and years sort of getting back to anything that's normal. I think, any time in the past in history, when people have been vaccinated, when people have had outbreaks and pandemics, then it's taken sort of years before society has sort of recovered from that. And I think we'll be no different from the side effects of COVID.
Okay, thanks to the two of you. It's now time for me to wind up before Rogers cuts me off. To our audience, it's been a pleasure to host this event. Thank you for watching. Let us know what you liked about the program. And of course, if you have suggestions for us, you can email us at mcc_ourhealth@outlook.com. I think that address is on your screen. Also, take the opportunity to watch this program again or recommend it to your friends. You'll be able to view it on demand very shortly, either on the websites at MCC or at the Rogers TV. And a great big thank you to our two speakers. You're both very busy doctors and dedicate so much of your time to protect us. A special and very sincere thanks for what you do every day to keep us well and safe. We appreciate the time that you've taken tonight to deliver such important messages about vaccinations. We wish both of you the best as you continue to lead us through what are hopefully the final stages of this COVID pandemic. Thank you.
Thank you.
And to our 7 sponsors, thank you. And we will see you 6 weeks from tonight for mental health and addictions in the time of COVID. That's May 6th. Good evening.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
Our son is one.
My father was one.
I am one.
Are you one?
With NHL Center Ice, you get a premium ticket to the games you want every night of the season. Catch every key out-of-market matchup each week. You'll get more goals, more saves, more non-stop action from the teams you love. NHL Center Ice, part of the Rogers Super Sports Pack. All this for only $35.95 a month. Order through your remote on Channel 450 or call 1-888-ROGERS-1 today.
You're watching Rogers TV Midland.
I'm bringing mayors together from a handful of awesome communities from across the country for a fun and informative competition called the Bring Your A-Game Quiz Show. As always, it's presented by Canada's Top Mayor Award. I'm Adam Grove, the Cash Cab Guy. I test their smarts on general knowledge and pop culture trivia questions based on their cities or townships or their personal stories while you play along as you watch the show. We're putting the spotlight on people and places that are enriching the lives of Canadians. This episode of the Bring Your A-Game Quiz Show is sponsored by San Diego Homes of Simcoe County. See the San Diego difference. And Daniel May Forest Hill Real Estate, always here to get you to the next chapter. You and our sponsors are helping us to raise money for Food Banks Canada, a national charitable organization dedicated to helping Canadians living with food insecurity. You can donate online right now at bringyouragame.ca, or you can scan the QR code that's on your screen with your mobile device. Now, all of the communities that are featured on the show are on the lands of the original peoples, the Ungwe-Honwe of Turtle Island. And much like the First Nations, Inuit, and Métis people long ago who came together with their community leaders